So the common symptoms that most patients present with esophageal cancer are difficulty in swallowing solids, which then becomes difficulty in swallowing liquids, weight loss which is not intentional, chest pain, coughing, hoarseness of voice, indigestion, or if you have indigestion which is worsening over a period of time. If you have any of these symptoms which does not get better over a period of 2 to 3 weeks with simple medicines, you must take advice and get yourself investigated. So the exact cause is not known, but there are certain risk factors which are there which increase your risk or chances of developing esophageal cancer. For any cancer, generally we say it's all about genes and environment. Esophageal cancer is usually not hereditary, but there are some various rare syndromes where it may be hereditary. Environment is the other factor which has a major influence in increasing the risk of esophageal cancer, and some of the major environmental factors are those factors which cause increased irritation of the lining or the mucosa of the food pipe, that is the esophagus. There are some things which are in your hand, which is maintaining a healthy weight, and you can maintain a healthy weight if you have a balanced diet which has enough fruits and vegetables and being active, being mobile, exercising at least 30 minutes daily, not using tobacco, not using alcohol, and even if you have tea or coffee, don't have it boiling hot that you swallow down because it will injure your mucosa. So these are the things that you can do immediately. So esophageal cancer should be treated by a group of experts who specialize in treating esophageal cancer, and most esophageal cancers we divide them into upper, mid and lower esophagus. There is a type of esophageal cancer called squamous cell which is common in upper and middle part of the food pipe. The adenocarcinoma is common in the lower part of the food pipe, and they may be treated slightly differently, and the treatment decisions are taken in a multidisciplinary team meeting which comprises of a radiation oncologist, a medical oncologist and a surgical oncologist who actually specializes in thoracic cancers or GI cancers. At APCC, we have a fantastic team. I'm very lucky to work with a team of doctors. I am a medical oncologist. We have a dedicated thoracic and a GI surgical oncologist, a dedicated GI radiation oncologist, and we're lucky also to have a dedicated GI pathologist and a GI radiologist as well. So we all sit together in a tumor board or a joint clinic and go through the patient's scans, pathology, all the tests that have been done, and come to a treatment plan. Esophagus generally does not cause back pain, but yes, if you have a chronic acidity problem or chronic gastroesophageal reflux disease GERD, that can lead to a radiating pain to the back, to the lower back as well. The incidence of esophagus cancer is very high in Northeast India, and one of the factors we think that may be causative of that is the smoking and the barbecuing of food, and also the hot liquids as well. But there was an Australian study which looked into this and found that there is not a very large association with it. But I think we must be mindful of this and take care.